And welcome back from lunch. I'm Mabel, Jong. You're watching live coverage of the World Healthcare Congress coming to you from Washington, D.C. This is WHCC TV. Thanks so much for joining us. And our next guest, his job is to weed out the winners from the losers in his space. He works in venture capital in the healthcare space, and we're very pleased to welcome Brent Stackhouse to the studio chair. How are you doing,
Wonderful.
Brent?
Thank you so much for having me. It's such an honor and a privilege to be able to join you today.
Thank you, Brent. Well, I heard some of the folks attending the conference singing your praises too.
They don't know me well.
Because you're in the business of connecting people. I mean, connecting money with projects and weeding out good deals from the bad deals. So that's a full day's work.
We try and we hope.
Yes. I mean, what's interesting to you in this space right now?
So working at a hospital, having a venture fund isn't really something that people expect from their healthcare provider.
Right.
It's growing in popularity right now. We see an increasing number of hospitals around the country of every size imaginable, the big, massive hospital systems to small local community hospitals, either looking at or launching venture investment funds.
Right.
And I think at first blush, it seems to make a lot of sense. You have a big building full of people trying hard to solve a number of challenges that have been really ailing our communities for years, and you have all sorts of capital right now that is chasing a number of solutions to those challenges. And so it would only seem to make sense that, like many other corporations around the world, that we launch a venture fund to try to augment and accelerate some of the development of those solutions. However, it's not easy. And it's been really challenging.
Yeah.
Mount Sinai actually launched a venture fund fairly early in 2008.
Okay.
It was a part of actually a hospital system that eventually merged with Mount Sinai. A lot of the investments they were making were in care delivery. These were surgery centers, urgent care centers, endoscopy centers. And about 5 years ago, they started making investments in other things, service companies, medical devices, digital health solutions. And so right now, about 3/4 of our portfolio are still that care delivery investment type, and the other quarter is sort of what I think of as innovation investments, kind of everything else.
Okay.
We don't invest in therapeutics. We don't invest in anything that has a long sort of FDA approval cycle, and we're trying to find solutions that people within our health system use. So unlike a lot of other fantastic venture programs, both institutional or corporate, I am not a gateway for innovation at Mount Sinai. You don't come to me and then I pair you up with the appropriate person within the department, be it clinical or administrative. I actually look inward and I work with our teams to figure out what it is at Mount Sinai that they're using that they're excited about.
Because you're affiliated with Mount Sinai, I mean, you are a Mount Sinai
employee.
company.
I'm a Mount Sinai employee.
Yes.
Our money for our investments come off the balance sheet of the Mount Sinai Hospital.
Okay, so are you better positioned to know exactly what the organization needs versus someone from the outside who's trying to get into the healthcare space?
So yes and no. I think it all depends. Again, I'm working with subject matter experts across the health system, and these are sometimes clinicians, and sometimes these are folks who work in procurement or supply chain or some other operative function within the hospital. And I'm asking them, what are you using right now? What are some of these solutions that you're using right now that you're excited about? What are some of the challenges that you're facing? And what have you been evaluating? Who's been approaching you? Based upon that feedback, I then try to go out to the community and figure out how those solutions compare to what else is out there in the market. Although we'd like to think that we're always using sort of the best and brightest solution for the challenges we face, I recognize that we're a large, busy health system, and as a result, they're not necessarily looking across the ecosystem to say, well, is this the best solution? Is this the most well-capitalized solution?
Right.
So as a result of that, something that we've been working on at Mount Sinai is actually collaborating with a lot of the other hospitals around the country. And that's become incredibly helpful, where we call on other hospital venture funds to say, hey, here's a solution in radiology, artificial intelligence that we're starting to work on in our radiology department. It looks interesting. What are you guys seeing? And sometimes the feedback and the findings are really surprising.
Okay.
About a year ago, I was looking at non-emergency medical transportation companies. So these are like Uber or Lyft, but to move patients back and forth between healthcare settings.
Okay.
And I had been approached by 3 or 4, and I'd never heard of this market segment before. I was like, what is this? So I started calling, and it turned out there were 23 non-emergency medical transportation companies that the 20 or so hospitals that I called worked with. And I don't mean had heard of. I mean, they actually worked with them. And Mount Sinai was using 3 just on its own. So to me, that was sort of an indicator that maybe it wasn't where I was comfortable making an investment. It seemed like there weren't very large barriers to entry and that it would be hard to find value creation there. So it was really informative to be able to turn to our partners. So that even though Mount Sinai was using something, which is a great indicator that the company will be successful and that there's a good market fit within major healthcare system, it doesn't necessarily mean it's a good investment play.
Okay.
And so as much as I like to rely on the expertise of my colleagues in the health system, I absolutely also rely upon professionals both at other institutions as well as those who work at some of the research organizations like Health 2.0 or Rock Health or Startup Health for some of the feedback that they have.
Well, if you're an innovator and you want to get into this space with an idea that you have, who do they approach? Like, for instance, when you mention the non-emergency transportation, somebody thought of it first, and then it just sort of spread out from there. So how do you be the first person that identifies a trend, a need, a problem that should be addressed?
That's a fantastic question. If I knew how to answer that question,
yes, I mean
I would probably get paid more and have a different job.
Well,
it's really tricky, and I think all of us really struggle to sit there and understand whether or not what we're looking at right now is actually meeting the needs. And a lot of times you can have a fantastic solution that makes sense based upon the problems that we're facing, but unfortunately just the way the product or the company or the service is designed, it doesn't fit within sort of the care workflow of a particular institution. And I come across things all the time that I think are really exciting that Sinai is using, but then it turns out that for whatever reason it just didn't work within the care pathway of the nurses, or it didn't really make sense based upon how our electronic health record system was set up, and it just isn't going to work out at our institution.
I'm sure you hear all the time that healthcare is so complicated in the United States. All of these innovations are making life better or kind of more complicated.
Yeah, so unfortunately I'm really cynical. I think that there's so much money in the marketplace right now that it's not particularly difficult to get an idea funded. And as a result, there are a lot of entrants in the market, and you see lots of sort of duplicative solutions. And I think it, to a degree, kind of waters down what the opportunities may be for those solutions to really flourish, because it seems like every hospital has a different medication adherence tool. And we saw this with electronic health record adoption 10 years ago. I was working for the city health department, and we counted 82 different electronic health record systems in the 5 boroughs of New York alone. And if you think about the resources needed when it comes to IT support or training of staff, all of a sudden you have all of these different skills and that are sort of depleting some of the efficacy that one would hope for. So one of the goals that we hope, working with some of our partners at other hospital venture funds, is to try to see if there are opportunities for us to be able to sit there and identify solutions together so that we actually collaborate and we try to help our institutions, which may be at first blush competitive with each other, actually find ways to work together to try to decrease some of that fragmentation.
I mean, do startup companies that want to work with you get healthcare really, or are they coming from a different space where they're just trying to come up with the neatest and the latest and the greatest?
So I think I'm somewhat fortunate that I hide behind my institution, and that by the time I'm talking to a startup company, it has gone through some degree of diligence from a real subject matter expert. And that they're not coming to me and saying, hey, I have a solution, I think this is neat, I'm going to get you excited about it, now you go try to figure out whether or not it's going to fit within Mount Sinai. I think if that was the case, you're right, I would be seeing a lot of stuff that might be a little clunky and might not quite fit.
Yeah, are you confident that we're headed in the right direction through the innovations that you're seeing, that we're going to be able to kind of figure this out, which this conference has been doing this for 10 years, trying to figure it out with folks here?
Although cynical, I do remain hopeful. I don't think technology is a cure-all, but I definitely think that some of the challenges that we're facing right now can definitely be improved upon. And unfortunately, a lot of healthcare is really antiquated. I know health systems in this country that still do procurement on triplicate, literally carbon copy triplicate. I have to explain to maybe some of our millennial watchers at home what triplicate is.
It's true.
But I think there are definitely opportunities and innovations. And one of the things that I look for on that note that I'm excited about are the business-to-business solutions around hospital operations. There are a lot of great buzzwords out there and really exciting ideas around artificial intelligence and machine learning and 3D printing. But at the end of the day, where I see there to be value on the investment side is trying to get hospitals to be more efficient on their administrative processes. I saw a statistic that 15 or 20% of healthcare costs are administrative overhead. And so if you have a system that doesn't have a smart supply chain solution, that there's a really good chance that they're sitting on hundreds of thousands, millions of dollars of unused inventory, might be expiring in their closets. And that's a great place where technology today can come in and have a solution. And we invested in a supply chain management company for exactly that reason.
All right, Brent Stackhouse, such interesting work you're involved with.
That's
really.
so kind of you. It's such a pleasure speaking with you today.
May I ask you how the conference is going so far?
Oh, it's been fantastic. This is my first year at the World Health Congress.
Okay.
It's very exciting. I was very surprised to find out it has nothing to do with the world nor Congress, but I'm still excited to be here.
Great to have
But there have
you
been
here.
some really terrific panel discussions, and I've been incredibly impressed with the caliber of people that they've been able to bring in. How I snuck in is beyond me, but I feel very fortunate to be here.
I think you passed with your credentials, Brent. Thank you so much.
So kind of you. Thanks.
And thank you for watching. Stay with us. We have more content coming up.